First, Republican senatorial hopeful Sue Lowden said people should barter with their doctor. Her campaign said by barter, Ms. Lowden meant haggle, to which Ms. Lowden said, no, I meant barter. And by barter, I meant paying for your health care with chickens. Our third story in the countdown, Nevada's chicken lady has officially flown the coop. Now she says that bartering is not a policy, it's a fact. Also a fact, Lowden's dwindling poll numbers against Senator Harry Reid. In an op-ed for Politico, Ms. Lowden accusing Mr. Reid and the Democrats of turning this race into a zoo. The comment I made about bartering was not and was never intended to be a policy proposal. It was an example of how struggling families are working to pay for medical care in any way they can during these tough times. Elaborating further on her blog, bargaining, bartering, and negotiating for health coverage is not a policy, it is a fact. Nowhere in my health reform proposal do I discuss bargaining, bartering, or negotiating. Rather, I offer real solutions that work without creating a new government-run entitlement program that Nevadans don't want and they cannot afford. Here's what Ms. Lowden actually said. See if you think she's talking about the facts of how people pay for health care.
Let's change the system and talk about what the possibilities are. I'm telling you that this works. You know, before we all started having health care in the olden days, our grandparents, they would bring a chicken to the doctor. They would say, I'll paint your house. They would do, I mean, that's the old days of what people would do to get health care with their doctors. Doctors are very sympathetic people. I'm not backing down from that system.
And now a new Research 2000 poll for Daily Kos shows Nevada voters are backing down from supporting Ms. Lowden. Senator Reid, once trailing her by double digits, may have a shot at this thing if Lowden makes it through the Republican primary. Reid's only down 4 points, 41% to Ms. Lowden's 45%.